what the setting is at. It'll show it to you. So you have that. The settings that are at the bottom are what the vent is going to do. So depending on what setting you pick, these will change. So this is giving you how much oxygen is going to be delivered, the tidal volume, the respiration rate, your PEEP, and your inspiratory-expiratory ratio. There's more, but don't really worry about that. So your biggest thing is when you're turning it on, you're intubated the patient, get your gender and your height, because it's going to do a calculation for lung size kind of thing. And then you're just going to push the emergency button. Okay? That starts. It just goes. You can always change things from there too. So you're not like committed. You have total power. Just as a quick overview, so now you're venting. This section is the patient's response to this. Okay, so you have your FiO2, which is how much oxygen is being delivered. Your respiration rate, so if your patient is fighting against it, you'll see things changed. As well, if the patient's maybe not sedated enough or fighting it, your peak pressures will change. These are the things you're going to look at. Once you have it going, your next step that you kind of need to do is you need to set your thresholds for alarms. And you just pick anything. See these little dark blue sections? You hit one and you just press auto set. So those are and confirm. That's your most important part. And then everything from there is kind of like you got some time. Okay, so if you want to change anything, you're pushing a button and just dialing. It's very straightforward, very user-friendly.
We are not RTs, but we can call one if we need to.
And you can always call one. Yeah,
On
there's lots of friends. And VCC, VCC, they'll come on. They're very helpful. Okay, so does that make sense? Okay, I'm gonna go pause this. We're gonna go back to the home screen. Okay, from the home screen. So we set it up so you have BiPAP as a quick button. So PSV, NIV, same as BiPAP. Okay? So people forget. So what that just means, pressure support, ventilation, non-invasive. So that's what BiPAP really means. So you're getting inspiratory pressure and expiratory pressure with the vent. So what you need for this is this mask, this kind of mask. They're right over there. These masks, what's different from the other things like the box or like different ones that are just CPAP, BiPAP, they'll have a vent here for the patient to breathe out. You don't need that with this because you have it here. So it just goes through your tubing. So you need a closed mask. Okay, so this is what you're using, and you can use this for CPAP or BiPAP. When you go there, say okay. It's gonna start. You'll see your tabs at the bottom are a little bit different. Your tidal volume is not there anymore. It just is your PS for pressure support. And these are the things. So they might do BiPAP 10 and 5. You're changing your pressure support and your PEEP. That's like just how it's written oftentimes.
The top number is how much pressure is blowing when they're inspiring, and the bottom number is how much pressure is while they're expiring.
Yeah, so it's
keeps the airways open.
Exactly. So you can change that here. It also has, if you do scroll through on BiPAP and CPAP, it has this yellow button that if you click, the only two settings I believe that have this, it has like a rescue setting. So if you got your patient in here, and lots of patients don't like this. So if for some reason your patient goes into like a respiratory arrest, or codes, so they stop breathing, you will have these settings will come up after about 20 seconds. It recognizes the patient's not breathing, and it will go to that rescue setting, and it will deliver more of a tidal volume. It'll give more pressure, and it will do a resp rate of 15. Okay, so it's going to keep doing that. If your patient starts breathing, it will. I believe it just kind of turns off. But you can come back in, and once it goes to it, it will say apnea ventilation it will have an alarm. So it will tell you, come over here. I'm helping you, but come over here now and do something about this. So that's where your BiPAP is. So the PSV, NIV. So if we go back to the home setting, you can go from right there, but we'll just stop it. CPAP. So once you're in here, all your other options are in ventilation modes. And you'll have a non-invasive and an invasive that you can do, but CPAP is just right there. And that's just your inspiratory pressure and it's just 2 settings. So it's very basic. Patients tolerate this well. Sometimes I've found that people, like if they're trying BiPAP, but it's like more of a trial, they'll sometimes try CPAP to see if it works before jumping down to saying, forget it, we're going to intubate. But it's just so you know it's there. Typically BiPAP is what you'll probably do a little bit more, but it's there. And it's BiPAP start. So the CPAP's the one you have to go looking for. Everything else is right on your home screen. That's the biggest thing to remember, and this mask. And I think what we'll have to do is, because I think I still special order these, and if Jason needs them, he just comes and takes them which is fine, because we don't actually use these very much. I think I've used 2 this year so far in Blind River, and that might be yes, it's just Deanna days. But oftentimes, like, we don't use it that much. So that's why people do forget about them. Okay. Do you have questions about this? Does that make sense?